Good afternoon, everyone. Good afternoon. As folks start to enter into the room, we want to make sure that everyone is nice and comfortable. Welcome to our Zoom session on exploring the healthcare profession, part 5. This is the last part in this series. I just want to first start off with some introductions of myself and Ms. Peter Gay Porter. We both work with Peter Gay works with the Western Mass Higher Regional Employment Board, and I work for Mass Higher Springfield Career Center. And let's briefly go over what we do at the Career Center. I am the YouthWorks specialist, the coordinator of the YouthWorks department. I work with all young adults anywhere between 14 to 25 and helping them get allotted to finding a job, acclimated to finding a career path, whatever your needs are regarding looking for a job or a career pathway, we are here to help you. If you have entered this session and you did not register, we are encouraging all attendees who are young adults and interested in getting additional supports with regards to what I just spoke about to go to this website, as you see as it appears on the screen, and register for Mass Higher Springfield YouthWorks Department. All of our services are free, and everything that we provide for you is to help you move forward in your desired career path. It's just some basic, simple steps. You're just going to go out to masshigherspringfield.org/YouthWorks. You're going to click right in the middle of the page where it says Join YouthWorks Now. We request that you complete the registration form, and then within 24 hours, you will receive an identification number. That number lets you know that you are officially a member. All of the services you will receive are free. And then this number will allow you to join other webinars, other trainings, other workshops, and work closely with myself at the Career Center. And as I promised, here's the contact information of the host and co-host today. Again, my name is Phyllis Gideon, the youth specialist at Mass Higher Springfield YouthWorks Career Center. That is my email and my phone number. As I indicated earlier, my co-host is Peter Gay Porter. She is the manager of healthcare workforce initiatives. And she's at the Regional Employment Board, so I'll change that. I keep wanting to change that. And so here's her email address, and that's her contact number. Peter Gay is a really great resource if you're looking at different schools, different programs that are available, if you're looking to connect with some of the schools, or if you're looking at seeing if your school provides any other initiatives or programs throughout the city. So it's a great opportunity for you to connect with both of us because we're a wealth of information and resources. For our panelists today, who our objective is to teach you about the healthcare major. We also have an employer online where you can learn about the different career options and employment opportunities that are within a hospital setting. And then we're going to have the great opportunity to speak with a nurse about her personal experiences and her affiliation with the National Association of Hispanic Nurses of Western Mass. And so today's panelists are Lori Malakin. She's a staff assistant at the School of Health and Patient Simulation in Springfield Technical Community College. We have Janice Andrades. She's the nurse practitioner, and she's also affiliated with the National Association of Hispanic Nurses of Western Mass. And we have Josh Maybar, who's the recruitment manager at Cooley Dickenson Hospital. Again, we just want to reiterate what our objectives are with this particular webinar. Let's talk about the fact that healthcare careers are exciting and they're booming, especially during COVID. There are over 250 different opportunities available. We're going to look at different education opportunities, requirements. We're going to look at different jobs. And we're also going to maybe talk about some salaries that you can earn. We're going to look at the occupational opportunities where you can have a successful career in healthcare. And that we believe if you're someone who wants to change lives and you like working with people, then this is the profession for you. Please note that throughout the webinar, you will have the opportunity to ask questions. We do have 2 sections in which you can ask those questions. There is the Q&A section, and there is also the chat section. Note that any question that you ask, we're going to respond to that verbally. We will not be typing any responses as we want to record this entire session. We encourage you as the presenters are speaking to send those questions directly either to the chat or the Q&A, but all questions will be answered at the end of all presentations. So we're going to make sure we have enough time for that. I have spoken enough. I'm going to actually turn over to Lori Malikin from Springfield Technical Community College as she's getting ready to start her presentation and prepare. What I'd like to do is take a poll and see how's everybody doing today. And as the poll's in progress, Lori, you can go ahead. If you want to start your screen, that's great. So a lot of you are saying you're feeling great today. Well, I'm excited about that. I think it's extremely important that we have a good energy and a good vibe going on in this webinar. And I hope by the time you leave this webinar that you are informed and you're feeling even more energetic about participating and moving into the healthcare field. So now that Lori seems all set and everyone's answered all the questions, we're all feeling good about this session. Go ahead, Lori, take it away.
So are you seeing the presentation?
There we go. We're seeing it now.
Okay. All right. So my name is Lori Milliken. I'm the staff assistant for the School of Health and Patient Simulation at Springfield Technical Community College, also known as STIC. And what I'd like to do today is discuss or cover some career fields where for which STIC is currently offering educational opportunities. And those are dental hygiene, diagnostic medical sonography, fire science, health information technology, health science, medical assisting, medical coding and billing, medical lab technician, nursing, occupational therapy assistant, physical therapist assistant, radiologic technology, respiratory care, and surgical technology. So dental hygienists clean teeth, examine patients for signs of oral diseases, and provide other preventative dental care. They also educate patients on ways to improve and maintain good oral health. After you receive your associate's degree at STIC, you still must pass the National Board Dental Hygiene Exam and the Regional Clinical Licensing Exam before you can receive your state license and practice as a dental hygienist. And according to the labor statistics, the 2019 median pay for a dental hygienist was $76,220 per year. So being a dental hygienist is a very lucrative career. Diagnostic medical sonography diagnostic medical sonography program will prepare you to operate special imaging equipment, to create images, or to conduct tests. You'll be part of a rapidly growing technology used to locate, evaluate, and record pertinent anatomical, pathological, and functional data to aid the physician in the diagnosis of disease and injury. The program at STIC blends classroom, laboratory, and clinical practicums to prepare you for specialties of abdominal and OBGYN sonography. Again, this is a very lucrative career. The median pay in 2019 was $74,320 per year. At STIC, we also offer in the School of Health at STIC, we also offer a couple options in fire science. One of them is our fire investigation transfer program. Fire investigators are those that research the causes of fires. And this program at STIC is intended for those who would like to pursue a bachelor's degree in fire investigation, homeland security, or fire science. We also offer a fire protection and safety technology program. And this program is designed to provide professional training for students in careers as firefighting professionals. And this program is designed to meet the needs of potential and in-service firefighters seeking promotional opportunities by providing practical and technical instruction. In 2019, the median pay for a firefighter was $50,850 per year. For those who have a desire to work in the healthcare field, but aren't necessarily sure that they want to work directly with patients, we have a couple of opportunities in for careers that are kind of behind the scenes type careers, but are still working in the healthcare field. And that is health information technology and medical coding and billing specialist. Health information technology professionals manage a wide variety of healthcare information needs, ensuring that medical records are complete, accurate, and maintained in accordance with the law and governmental regulatory bodies. Graduates from this program at STIC will have strong technical knowledge of health career delivery systems and electronic health records systems, as well as the skills to process and prepare health information for insurance submission, quality assurance compliance, and reporting. But medical coding and billing specialists manage insurance claims, invoices, and payments. The medical coding and billing program prepares students for employment in hospitals, ambulatory centers, visiting nurse associations, insurance companies, physicians' offices, and many other health organizations as a medical coding and billing specialist. The median pay for this career field, these career fields, is $42,630 per year. We also offer a health science program at STIC, and this program introduces students to interdisciplinary topics in healthcare and provides the opportunity for students to explore specialty areas for a career in healthcare. This is a very broad, health science is a very broad field. The program at STIC offers flexible options for students to gain preparation for clinical careers and specialties such as occupational therapy, medical lab technician, and nursing, as well as administrative and supportive career roles. The health science program at STIC offers a window to the range of possibilities in the healthcare field with job prospects in hospitals, clinics, government agencies, or nonprofit organizations. One of the unique things about the program at STIC is that as part of the curriculum for the program, you are required to take a certification course. And currently we offer 3 different certification courses at STIC: the EMT, the phlebotomy technician, and the sterile processing technician. As many of you may know, EMTs respond to emergency calls, perform medical services, and transport patients to medical facilities. Phlebotomy technicians draw blood for tests, transfusions, research, and blood donations. And sterile processing technicians clean and sterilize used surgical instruments and other medical supplies so that they can be safely redistributed and reused on additional patients. So even in our health science program, by completing one of these certification courses, you still come out with an employable skill, which is a very nice component of that program. Medical assistants perform administrative and clinical skills in a variety of healthcare settings, such as physicians' offices, outpatient clinics, laboratories, and hospitals. Duties vary, but could include performing vital signs, assisting with examinations, recording electrocardiograms, scheduling appointments, processing insurance claims, and maintaining medical records. At STIC, after completing the 1-year certificate, you can either enter the workforce or transfer into the associate degree program. The 2019 median pay for a medical assistant was $34,800 per year. Medical laboratory technician is also another great career for someone who is interested in working in the healthcare field, but is not interested in working directly in patient care. The medical laboratory technician performs tests in all departments of the clinical laboratory, including blood banking, chemistry, hematology, immunology, and microbiology. You will operate complex electrical equipment, computers, and precision instruments. You will also be responsible for confirming the accuracy of test results and reporting laboratory findings. The program at STIC is a 22-month program and includes 4 semesters of classroom and on-campus laboratory work, as well as a 24-week clinical practicum. The median pay in 2019 for medical lab technician was $53,120 per year. Nurses provide and coordinate patient care, educate about health conditions, and provide support to patients and their families. The registered nurse at the associate degree level will be prepared for a career that provides compassionate care for all ages in a variety of healthcare settings. You'll be taught to communicate effectively, provide health promotion and maintenance, and administer care to persons with health problems. The program at STIC is an associate degree program, but STIC also has numerous articulation agreements to continue for those who want to continue on for your bachelor or higher degree in nursing. The median pay for nursing in 2019 was $73,300. Occupational therapy assistants help clients across their lifespan reach functional goals related to play, work, education, and self-care. For example, you may help an individual who has had a stroke relearn to dress him or herself, or may help a child with cerebral palsy learn to operate a computer with adapted equipment. You could work in a variety of settings, such as hospitals, clinics, rehabilitation facilities, schools, and community centers. In 2019, the median pay was $59,200. Physical therapist assistants work as technical health care providers who work under the supervision of a physical therapist. You would perform movement-related activities and therapeutic techniques for patients with burns, amputation, spinal cord injuries, and cardiac, neurological, and orthopedic injuries. Such techniques might include gait training, heat and cold applications, massage, and the use of assistive, prosthetic, and orthotic devices. The median pay in 2019 was $48,990. Radiographers, also known as X-ray or radiologic technologists, perform diagnostic imaging and examinations such as X-rays on patients. You'll be trained to position patients, evaluate images for diagnostic quality, use appropriate radiation protection, apply appropriate technical skills, and communicate effectively with patients. This 21-month program includes a 12-week summer clinical practicum. You'd be after completing the program, you'd be eligible to take the national certification exam. The median pay in 2019 was $62,280. Respiratory care, this career field gained a lot of attention because of COVID-19, because respiratory care therapists were very sought after in hospitals to assist patients who were struggling because of COVID-19. Respiratory care practitioners work closely with patients and other healthcare providers. You acquire skills in the treatment, management, diagnosis, and care of patients with cardiopulmonary dysfunction. Training will include the use of therapeutic gases, ventilator support, breathing exercises, aerosol administration, medications, humidification, and maintenance of airways. You will likely work in a hospital. However, opportunities exist in many areas of healthcare. This 2-year program includes a summer session, and the median pay was $61,330 per year in 2019. Lastly, we have our surgical technology program. The surgical technologists handle the instruments, supplies, and equipment necessary during the surgical procedure. They have an understanding of the procedure being performed and anticipate the needs of the surgeon and have the necessary knowledge and ability to ensure quality patient care during the operative procedure, and is constantly on vigil for maintenance of the sterile field. In 2019, the median pay was $48,300 per year. What I'd like to do now is talk a little bit about the application process for anyone who may be interested in applying to one of our programs at STIC. For all of the programs at STIC, you'll need to submit an admission application, a high school transcript, and any transcripts for any colleges or universities previously attended. Admission prerequisites vary by program. It's very important, if you are interested in one of the programs, to explore a little bit on the website. Each program has a page that's called Applying to this Program, which will let you know what the pre-admission requirements are. Like I said, I highly recommend that you visit that site if you are interested in applying to one of the programs. Each program also has a program-specific admission checklist, some which are required for admission and some which are highly recommended. Again, you can reach this website by going to stcc.edu/explore/programs. Another quick and easy way to find it is to go onto the STIC webpage at stcc.edu, and towards the top of the page, you'll see a link that says Explore Programs and Classes. Again, application deadlines vary by program. Nursing is February 1st. Most other competitive programs are March 31st. Again, it's best to refer to the applying to this program for each program's page in order to get the accurate information on the deadline for the program that you may be interested in pursuing. Why choose STIC to begin your health career? At STIC, all of our programs are accredited. If there's an accreditation available, then the STIC program does have that accreditation. You always want to make sure that a program that you do attend is accredited, because this will make a difference if you want to pursue testing, for the testing or examinations that may be connected with the program. Many times you need to have graduated from an accredited program in order to take the examination, the licensing examinations. At STIC, we also have the largest simulation center in the Northeast. And the best way to describe this is it's like a pretend hospital. We have simulated robotic patients that pretty much can do anything that a real patient can do. The smells, the noises, it's super realistic, and it's a great opportunity for students to practice their clinical skills in a setting where it's okay to make, even though you don't want to make a mistake, it's okay to make a mistake. It's better to make a mistake on a simulated patients than when you get into a real setting and you're working on a real live patient. This type of classroom setting bridges the gap between classroom and clinical, so that when you are in a clinical, that you do have the confidence that you need to perform in a live setting. The programs at STIC are nationally recognized and respected. Our nursing program was named among the top in the state. The medical assisting program ranked top for affordability and quality. And our medical lab technician program consistently achieves 100% placement and pass rate on national boards. And most of all, STIC is affordable. You can begin your career at STIC and you can save money, and you can also transfer to four-year programs with many articulation agreements that we have. Again, if you're interested in learning about our articulation agreements, you can reach out to, you can look at the website or reach out to me, and I can assist you with researching those. So if you want to learn more about a specific health program, like I said, I encourage you to visit the college website and take a look at the different programs and learn about what is needed to apply to the programs, what the admission prerequisites are, and to gain more information. I just briefly and quickly went through a lot of information, or a little bit of information about many programs, but the website offers a lot more information that's very valuable to you if you are interested in pursuing one of these programs. You can email the School of Health, or you can also call. The information is on the right-hand side of the screen. The email address is shps@stcc.edu, and the phone number is 413-755-7477. If you place a phone call, you'll need to leave a message, and then someone will get back to you. Because of COVID-19, many of us are currently not on campus, but if you do leave a message, someone will give you a call back. So I encourage you to take a look at the programs that we have at STIC, and I look forward to answering any questions that you may have in regards to any of our program offerings. And thank you very much.
Thank you so much, Lori. It was great information. I hope everyone found they're jotting down the contact information and going to follow up with STCC with regards to their programs. I also know that we as a career center work very closely with STCC as We used to provide financial assistance for individuals looking at different allied healthcare programs. So as Janice Andrades, we transition over into her slide. Peter, are we going to launch another poll, or are we going to wait to the end? Okay, so we are launching that poll now. I'm going to ask all of my participants in the room to please participate. And we want to know, do you know your desired career pathway within the healthcare industry? The purpose of these webinars is to help give you an idea if you don't. And if you do, hopefully you found that career pathway and you're being more informed and educated on the different steps you'll have to take as you progress along that career pathway. If you have not, don't worry. Feel free to send myself or Peter Gay an email so that we can ensure that you get the information you are looking for and that you get connected to the right individuals. Continue to send those questions, as we're getting several questions throughout the webinar, and we're so excited that we'll be able to answer those at the end. So I just want to check with Janice Andrades. Are you ready, Miss Janice?
I am ready.
Okay, Peter Gay, we can shut down this poll right now. And let's switch over to our next panelist.
So good afternoon, everyone. My name is Janice Andrades. You see here, my name has a bunch of initials, and just to explain that, so it's doctor because I have a doctorate degree in nursing. The DNP is the official title, Doctor of Nursing Practice. All the initials after the AGACNP basically just mean that my specialty is adults, gerontology, which is elderly patients. The AC is acute care, so I work with patients in the hospital. I'm a nurse practitioner, and then the last thing, which says BC, that just means that I took a test and I'm board certified. Next slide. Next slide, please.
Sorry, I'll get that back up there in a minute.
No worries. Technical difficulties are our specialty.
Absolutely. Just roll with the punches.
That's it. That's it.
I think the goal of my presentation is just to talk to you from the perspective of someone who started off not really knowing where I was going to go. And then 10 years passed, and now I'm a nurse practitioner. So my perspective is just, I've kind of been there, done that, and just want to tell you my story and let you know that whatever your goal is in the healthcare field, you can definitely achieve it. So reasons to be a nurse. You can make a difference in the health of the Hispanic community, not only the Hispanic community, but the community in general. I'm a part of the National Association for Hispanic Nurses. So our focus is the Hispanic community, but nursing allows you to make a difference overall. There's lifelong career flexibility, meaning you can work in the hospital, you can work in doctor's offices, schools. There's just a really big variety in nursing and what you can do. You can become a nurse practitioner like myself. You can deliver babies. You can work in the operating room. There's just a lot of flexibility depending on what you want to do. There's, again, you can pick different specialties and work in different areas in the hospital, outside the hospital. There's salary benefits. Nurses, we make pretty good money starting straight out of school, and you have a lot of opportunities for professional development, and there's definitely job security. Like, you're always going to be able to find a job as a nurse. Next slide. So just a step-by-step in the process of becoming a nurse. The first thing is obviously to decide that nursing is the thing for you. once you decide that, there's opportunities to take prerequisites even when you're in high school. Taking AP classes and things like that can help you to build your prerequisites before getting to college. Once you decide nursing is the step for you, you have to pick what you want to do. Do you want to get a 2-year degree? Do you want to get a 4-year degree? And that really all depends on what your long-term goals are and what you can afford. So you can go to a community college, you can go to a university, and either track is good. There's no right way to do this. It's just kind of applying and getting it done. And a really, really important step is seeking a mentor. I know for me, I was the only person in my family who chose nursing or anything in the medical field. And I'm one of the only people in my family to have gone to college, period. So it was really important for me to find someone to like trust in and to help guide me through the process because again, not coming from a family who has a lot of people who have been in college, I didn't really know what to do. So one of my mentors is Ruth, and she's the president of NON, the association that I'm in. And I just think it's really, really important early on to have a mentor so that you have that person that's guiding you and helping you through the process. Next slide, please. So these nursing school prerequisites, they're different for every college you go to, but this is just kind of overall what you should expect in your nursing program. So obviously, these classes go on top of your nursing classes, but you should expect you have to do 4 years of English, 3 to 4 years of math, and this would be if you choose to do a bachelor's degree or a 4-year course. Nursing is very heavy in science, chemistry, and that can seem overwhelming, but there's a bunch of tutors and people along the way to help you. You'll also have to take some social study classes like history and then foreign language. And for me, I speak Spanish, so I took a test and I tested out of any foreign language classes. So that wasn't a issue for me, but I just included it just so you know. Next slide, please. And where do nurses work? Like I mentioned before, nurses work in a bunch of places. Again, working in the hospital, doctor's offices, nursing homes, outpatient facilities like chemotherapy, offices, things like that, and also in home health services. There's something called a visiting nurse who is able to visit patients in their home and give them care there. So again, nursing just offers you a lot of variety. Next slide, please. Another great thing about nursing, and I think is my favorite thing, is the flexibility in schedules. You can work 4 hours, 8 hours, 12 hours. A lot of jobs in the hospital are 12-hour shifts. So you work 3 12-hour shifts in a week and you have 4 days off. And if you could play your cards right, sometimes that means having a week off without taking vacation, which definitely helps those who have families and who need childcare. Next slide, please. So a little bit more about my story. The picture you're seeing right now is a picture of my IDs. I started off 10 years ago going to HCC. I didn't really know what I wanted to do, so I took a year at a community college to figure that out. And at the same time, I started at Bay State Medical Center in Springfield as a custodian. I figured out that I wanted to be a nurse. And then the second ID is my ID again at Bay State as a nurse. And then the third ID is the ID of the job that I have now as a nurse practitioner. So I think that this picture is a good representation of my journey from being a custodian to a nurse practitioner at the same place. which is a really cool experience to kind of be a provider at the same place that you used to clean. Next slide, please. So just to get a little bit more specific, currently I work as a nurse practitioner in trauma. So I think it's important to define what a nurse practitioner is. A nurse practitioner is an advanced practice nurse. So I got my 4-year degree to be an RN, and then I went to school for another 3 years to become a nurse practitioner. And the major difference is, as a nurse practitioner, my job is a lot like a doctor. I'm able to write prescriptions, give people diagnosis, read x-rays, things like that, that just an RN isn't able to do. A day in my life at work, I go into work around 5 o'clock in the morning. I take care of patients after they have had gunshot wounds, stab wounds, car accidents, skiing accidents, falls, things like that. Sometimes I get to go into the operating room to care for these patients, but mostly I'm on the floor taking care of their blood pressure, making sure that their vitals are stable, and making sure that they, transition and are able to go home in the best shape possible. My goals overall have changed. When I was getting out of high school, going into college, my major goal was to find a job that I could make money and take care of myself. I grew up with a single mother, so money was tight a lot. And my driver through nursing school was, I just want to have a job where I can take care of myself and get the things that I want. And over time, my goals have changed. And I think that that's an important point to know that the big goal that you have, which would be to graduate college or become an MA, a physical therapist, whatever it may be, you just have to work every single day towards that. And sometimes we focus on that bigger goal, like I just want to graduate college. But I think it's important to do little things every day towards your goal, because one day you're going to look up and you're going to be that nurse and you're going to be that physical therapist. So I just think, again, it's important to have a goal, but make sure you have like your long-term goal and your short-term goal. And lastly, my decision to become a nurse was one that I don't have like that story where like I wanted to be a nurse since I was a kid. I wanted to be a lawyer. But when I was 17, graduating from high school, I didn't know how to do that. Like, I didn't know how I was going to pay for it. And there was no way at that time that I could see myself going to school for 8 years. So I was at an appointment with a family member, and a nurse talked to me about how awesome nursing was and how I could make a lot of money. And at 17, that was music to my ears. So nursing for me at first, again, was something that a career that I picked to make money, but then it developed into something that I truly, truly enjoy. Next slide, please. So I mentioned before that I'm part of NAN, and again, that's the National Association of Hispanic Nurses. And the main point of this is mentorship. I started with NAN during nursing school, met my mentor, Ruth, and have grown from there. So the mission of NAN is we're committed to advancing the health in Hispanic communities, to lead, promote, and advocate the educational, professional, and leadership opportunities for Hispanic nurses. But you don't necessarily have to be Hispanic to join the association. It's just, this is our focus. Next slide, please. A little bit more about NAN. It's the only national organization representing Hispanic nurses. There's about 49 chapters across the United States, which really opens up your network to being able to talk to nurses across the country. And we're committed to providing equal access to educational, professional, and scholarship opportunities. Next slide, please. Some of the benefits of being a part of NAN. Again, opportunities for scholarships, which is really important and was a huge struggle for me during my education. If it wasn't for scholarships and loans, I wouldn't have been able to go to school. So the fact that NAN offers it to its members is extremely helpful. You'll be a part of local conferences, leadership trainings, and network. And again, it offers a chance for mentorship. On a national level, you'd be connected again to nurses across the country. You'll be able to enhance your career ladder, and it gives you opportunities for educational leadership and community service awards, which look really good on your resume. Next slide, please. Next slide. And if any of you would like to reach out to me personally, this is my personal email. Feel free to contact me whenever with any questions that you may have. Thank you so much.
And my correction, Dr. Andrade, because I think it's really important that we acknowledge individuals in their successes. And it's an extreme honor and success to acquire your doctorate in any subject matter, not just being a medical doctor. And I really want to stress upon this point that this demonstrates this Ms. Andrade has beyond mastered the field of nursing, that she is considered someone who is a researcher, can be looked upon for information and advice. And so when you're receiving your doctorate at that level, at receiving your doctorate at all, you become someone that folks look to in the industry as the expert. So again, I just love your story. Thank you for sharing your information with us. I hope that all of the young adults that are in this room take advantage and really take an opportunity to reach out to you and have a conversation with you, because you never know who you can meet that can change the pathway, as Ms. Andrade just explained to you in her presentation. Next, we're going to launch it on a poll. If we can, Peter Gay, that would be great. And so, as we asked you earlier, if you knew about any of the healthcare professions or you've identified one, if you have not, please let us know if you need assistance. If you do, that's great. We are going to work with you, myself and Peter Gay will make sure that you get all the information you need and the supports that you need. If you don't, I still hope that you connect with us, because more information is just great information. And so we have closed our polls. Thank you for those who have participated. And we're going to move on to our last panelist. And this is wonderful that this is the first time in this series that we've had an employer participate. And I'm so excited because the information he's going to share with you is not just about recruiting for Cooley Dickenson Hospital. It is about the different employment opportunities that are in the hospital that we always don't see or we always don't think about. So I'd like to introduce to you Josh Maybar. He's the recruitment manager at Cooley Dickenson Hospital in Northampton, Mass. Josh, go ahead and take it away.
Thank you very much, Phyllis. Good afternoon, everybody. I'm delighted to meet with you all today. I wish I could see your faces, but it's great to be able to connect with all of you. And I feel it's a gift, honestly, to follow the two presentations that came just before. Lori Milliken, that was a great overview of STIC's program and kind of starting to give an overview of all the different opportunities within healthcare, as Phyllis said, and Dr. Andrade. I really appreciate your sharing your experience and your journey, and congratulations on your success. I love the slide of your different badges as you've advanced your education and position. So it was great to see. I guess I should have given my name first. Again, my name is Josh Maybar. I am the recruitment manager at Cooley Dickenson Hospital and Healthcare in Northampton. I've been there for about 14 years. And my goal really for today is just to tell you just a little bit about Cooley Dickenson in case we may be an employer that you're interested in considering and coming working for us in the future, just so you know we're out there. And then the second is really to be a resource for any questions I can answer about employment at Cooley Dickenson. My own background is really in recruitment and human resources, not even in healthcare. Again, I've been at Cooley for a long time, and healthcare is just a tremendous field to work in, whether you're caring directly for patients or you're in a support function like I am, just kind of helping to support the team. So can start with the next slide.
These slides always get stuck for some reason, so I'm working again to restart it.
No worries.
That's okay. As we say, we work
we
through
go.
technology. There we go.
Okay, very good. Thank you, Peter. So just a quick kind of overview. If any of you are not familiar with it, Cooley Dickenson Healthcare, we are a nonprofit organization, integrated, meaning all the parts of our organization kind of work together to care for our patients in the community. So it's a community healthcare organization. We're based in Northampton, Massachusetts, but we do have offices throughout the region, mostly in Hampshire County. There's a map on the next slide I'll show you, but so Cooley Dickenson Healthcare consists of 4 different parts. Oftentimes people think of hospitals, when they think of healthcare organizations, but as Dr. Andrade had in her slide, there are medical offices, there are people provide care at nursing facilities and home. So there's a lot of different settings. So we have a hospital. It's 140 beds in Northampton. We have a medical group of primary care and specialty care practices throughout the areas I mentioned. Our VNA and hospice division is the group that cares for patients at home, mostly in Hampshire and Franklin counties. And then Cooley Dickenson Physician Hospital Organization is the entity through which the medical staff and the hospital kind of partner together to provide care for patients. Not all physicians are employed by hospitals, even though they may work in hospitals. So it's an interesting structure, which is probably a whole other presentation. Cooley Dickinson's affiliated with Mass General Hospital in Boston, and we're part of Mass General Brigham as well, which isn't so commonly known here in Western Mass. But just at the high level, Mass General Brigham consists of 17 different entities. So while we are just one here in Western Massachusetts, we're part of something much larger in the state. And Mass General Brigham is actually the largest private employer in Massachusetts. Next slide, please.
Bear with me, please.
If you need me to switch PTK, I can as well.
Okay, maybe that's gonna work. For some reason, it just won't. You want to try to share yours?
Yep, I'm right now I'm doing it. Okay, let me know if you can see it.
Yes, we can.
Okay, great. Can you see it even better now?
Absolutely.
Great. So what we do and kind of where we do it, again, as I said, we're based in Northampton, but our goal as a healthcare institution taking care of our patients is to provide the right care in the right place at the right time. We want to make care as easy and as accessible for our patients as possible. Health and well-being can be stressful enough, especially if you're sick or have a diagnosis. So we want to be available for our patients as close as we can. As I mentioned, we have the hospital in Northampton, but we do have primary care, specialty care offices throughout the region, also lab, imaging, and rehab services, as well as some urgent care locations. And then our VNA and hospice division goes right to people's houses to care for them directly at home. And then who we are and why we do it. So Cooley Dickenson has approximately 2,000 employees. I think I saw on an earlier slide, an estimate of 250 titles in healthcare. We have 2,000 employees caring for our patients in all sorts of ways, some directly caring for them, and some in support functions, which I'll share kind of different job titles to give you a sense that healthcare goes, well beyond, doctors, nurses, and tech. There are all sorts of professions that can help. And I put our mission, vision, and values here just to give you a sense of kind of the why we do it, and kind of who we are. So while our employees come from throughout the region to care for our patients, we all share that mission, is to serve our patients and communities with exceptional, compassionate, and personalized healthcare. We want to be among the nation's best community healthcare systems for our patients and communities. And our values as a community and our values as an employer is to uphold quality, to demonstrate compassion, foster collaboration, show respect, and act with integrity. And then this next slide, as I mentioned earlier, how we do it is our job families. I'll give you a second just to kind of review all the different titles here. So as you can see, some of them were already mentioned in Lori's presentation. You can see respiratory therapy, you can see medical assistants, you can see nursing, but there's also food services. There's environmental services, as Dr. Andrade mentioned, cleaning, which is vital in a hospital to help with infection prevention. There's marketing functions, there's administrative, there's medical records, there's pharmacy, there's physical therapy, occupational therapy, social services, social workers. There's lots of different ways to be involved in healthcare, and having people kind of think about healthcare as an option is always kind of one of my goals. I wanted to take a minute just to kind of touch on career exploration and preparation, just because I'm a recruiter, and wanted to let you know in terms of kind of as you think about professions in healthcare or think about what education you might like to pursue, just searching on the internet, going to healthcare websites, employer websites to get a sense of what types of jobs are there. The more information you can get, the better prepared you'll be to help figure out where you may like to end up. And things do change. So you may start in one direction and decide that something else is a little bit better fit for you, but the more information you can get, the better. Informational interviewing, I think, is a little bit of a lost art. That just means interviewing people you may know, or maybe friends or family knows that work in healthcare. And if you have an opportunity to really speak about someone, what their day-to-day is like in their job, it's a great way to imagine what it may be like working in different fields. Volunteering or shadowing in a medical office or in a hospital is a great way to, again, see with your own eyes what things are like. It could be a little bit challenging right now with COVID, but if it's available to you, it's worth pursuing. As Lori mentioned, there are a number of educational programs at STIC and other facilities, institutions, and they have great kind of advisory offices. So you can ask them questions about their programs, anything you might like to know, even ahead of applying or enrolling. Lastly, in terms of getting ready for actually working in healthcare, just encouraging people to think about preparing a resume and preparing to interview. And then lastly, part-time or per diem employment. I always recommend, even while someone is in school, if you have capacity, there are a lot of kind of part-time or per diem, which just means, you don't have a specific schedule. There are a lot of different jobs that people may do even while you're in school, if you have availability, which have flexible hours in a hospital setting. There are day, evening, and night positions. And oftentimes people even work in one role. They may work in food services or in cleaning, in environmental services or in transportation, even as they're in school, which is great because it gives you exposure to the organization you're working. And also it helps you build relationships. Our favorite thing is when individuals work for us, go to school and then transfer into and are promoted to other positions. So I would encourage you as early as you can when you're ready to consider part-time or per diem employment. There's nothing better than having your own firsthand experience to help you decide what's right for you. Lastly, I just wanted to kind of show you a little video. Hopefully this will work. Picture says 1,000 words. Hopefully a video says more. Just wanted to give you a sense of kind of some of the faces and roles at Cooley.
Have you ever felt like something is missing in your current job? For us, work is never just a job. Here, work means keeping the community and every single person in it healthy and safe. As the world faces its biggest public health crisis in a generation, we step forward, ready and compassionate. As individuals, Cooley Dickenson employees work hard, but there's always a team behind us, ready to help. Every person, every job, every day. We proudly work together. The only thing we're missing is you.
Thank you so much, Josh.
My pleasure.
Really appreciate this wonderful presentation, and the video was just amazing. At this time, what I'd like to do is I'm going to share my screen so that I can switch over to the contact information that you guys will be able to have. So what I want to do is to be able to do that. Let me see. Sorry, wrong screen. And I want to go ahead and share that PowerPoint with you. So you guys will have that direct contact information. Let me know if you're seeing it. If not,
Phyllis, the first screen share you did actually showed the contacts before you removed it. Now we're just seeing your computer screen. So if you
okay.
want to reverse back to the first one you had. Yep, that's
Okay.
it.
Okay.
There you
Thank
go.
you so much, everybody. So again, and I've gotten Peter's title right and her organization right. So again, I want to go over this so that you know the right folks that you can contact. First, let's talk about our speakers for today. And so again, we had Lori Milken. She's a staff assistant with the School of Health, Patient and Simulation at Springfield Technical Community College. We have Dr. Janice Andrades, who's a nurse practitioner and also a member of the National Association of Hispanic Nurses of Western Massachusetts, and Josh Maybar, who is the recruitment manager at Cooley Dickenson Hospital in Northampton, Mass. And so I'm going to flip back to my slide with our contact information, and we're going to keep that slide up as we start to answer questions. Peter Gay, I've written some of the questions down, and I know who to pose the questions to with regards to the panelists. And if there are other panelists that'd like to add after, that would be great. So the first question I received was, what is a transcript? And I know that STCC had mentioned that. Lori, do you want to elaborate on that with regards to what is a transcript?
So I guess the best way to describe a transcript is that it's a record of your coursework and grades. So a high school transcript is going to have a record of all the courses that you took while in high school, as well as your grades. And it'll record your, I believe most high schools do record a GPA, a class rank. So a transcript is going to be a record of your time while in high school and what you accomplished while you were there. And it's the same with the college. The college transcript is going to be a record of what courses you took in college and what grades you received while you were a student at the college. It will also record, just like a high school transcript will record the date that you graduated. A high school transcript will also record the date that you received your college degree. So I guess that's the best way to describe that. I hope that answers the person who had that question.
Absolutely. And I'll elaborate on it a little bit as well. And so for young adults in the room who are looking at going into any type of education beyond high school, it is extremely important that you treat your transcript as it is a representation of you. It is a reflection of how you think, how you study, what you're learning. It is a reflection of the type of person you are and the type of person you're looking to become. And so it's not just about listing your grades or your GPAs, because in actuality, colleges will actually look at that, and some of that information gets weighted a little differently depending upon if you took an honors class or if you've taken a college credited course. And so I just encourage you to treat this as a serious document, treat it as something that is reflecting of you. And then when colleges are looking at this information, again, Lori can, and other folks who may have interacted with colleges on the panel can tell you that that's not the only indicator. A lot of institutions now, and if you've been in our previous webinars, speak to the fact that they're looking for a student from the holistic approach. Well, what does that mean? They're looking at a student's volunteer opportunities. They're looking at a student in terms of class participation. What have you participated in school? What are you bringing to our campus, just as much as what are we receiving from you as a student who's geared toward academic studies? So really, again, that transcript is like a resume. It is a document that represents you. The next question is, do you have to get your general education degree to attend STCC?
Yeah, so all of the programs at STCC require that you have a high school, that you've graduated from high school, have a GED or a high set. So you definitely will need to have one of those prior. The programs that I listed, all of those do need at least to have a high school diploma, GED or high set. There may be some programs through our workforce development, which I didn't mention any of those, that may not require a GED or high set or high school transcript, but that would be something that I don't couldn't really tell you right now if there are any, but that would be the only area that we may not require that type of documentation.
And what Lori is speaking of when she's talking through the workforce development section is that is typically a part of the institution in which individuals are already working in a field and they're looking to increase their credentials, or they're looking to increase their level of knowledge in their particular field. So there may be some individuals that are working in the healthcare field, working as a CNA, and may want to up their skill set in terms of phlebotomy or in terms of the sterilization program. And even those individuals who don't have a high school diploma, you will be tested. Even those individuals who do have a high school diploma, if you're going through our workforce development program, you will be tested, because we have to ensure that everyone who is enrolling in college programs or even in workforce development programs, that your skill sets will allow you to move through the programs with a nice even keel, that you can be able to flow with the class, you can understand the information being presented, you're able to handle the mathematical skills that are required to be in the course. So it's not necessarily a reflection on someone preventing anyone from getting in a program. It's just that in order for you to get into the program, to make sure that you're going to be successful in the program, that's one of the standards. Another question, Lori, they're coming in hot and heavy for you, Lori.
That's okay.
Is STCC free?
No, STCC is not free. However, there are different financial aid opportunities. And the best way to learn about what those opportunities are is to, you go on our website, and is some information through our Student Financial Services webpage, but also to contact them directly, because everybody's financial situation is different. And so the best is to talk to them, because they're going to know that they're going to be able to guide you better than I would be. I never even attempt to try to answer any financial questions, just because finances is very sensitive. So I would definitely suggest reaching out to our Student Financial Services department. But no, STIC unfortunately is not free.
But we will say this, Lori, in regards to and in relation to your institutions, your universities, and your colleges, the community college is a great, inexpensive way to start off into a field. I've worked in higher education, and I understand the cost that it can bear on a person. Even though you're getting financial aid, there is some responsibility on your end as a student to financially close the gap that institutions aren't able to award you. And so it's just really important that if that is a concern of yours, if wanting to be in a smaller class setting, maybe wanting to have a more hands-on approach before moving into the larger institutions, looking at area colleges, community colleges like Springfield Technical Community College and Holyoke Community College is a great first step. And most of the time, you're going to save yourself a lot of funding, a lot of financial aid dollars. And so you can spend some of those dollars as you move toward the larger institutions.
One thing I did want to mention that I just thought about was Springfield Technical Community College, as well as some other state and community colleges in the area, have something called dual enrollment, where you can take courses while you're still in high school. And those courses sometimes are free of charge through a specific program, and that's through our dual enrollment program. And that is something that is managed through our admissions office. But if you are interested in something like that, you could always email me, and then I could connect you with the correct person or the proper people in our admissions office. But that's a great opportunity for you to earn credit while you're still in high school. And like I said, that is through a grant program, and those courses would not be a cost to you, except there may be a fee for books, I believe.
Yes, you're right, Lori. There is a small fee for books, but like you indicated, the course program itself is at no cost. And I do believe once you matriculate into STIC, those credits become real credits
Yes.
upon enrolling into STIC. So that's a great opportunity to jumpstart while you're in high school.
And another thing too is like, as we're talking, I just thought about like some of you may have an opportunity to take AP courses and then take the AP exams. And depending on how you score on those exams, you may be able to transfer. You may be able to get college credit for those courses. So that's one thing I want to point out as well, that when you're looking for maybe courses that aren't going to cost you a lot of money, that's another opportunity as well. So if you score, I think at STIC, for the most part, if you score a 3 on an AP exam, for example, on a psychology exam, if you score a 3, that would transfer into STIC as if you completed the psychology course.
And that's 3 credits, guys. So when you start to get into the financial aspect of college and you start looking at credits, as Lori is talking about, you'll realize, oh, that saves me a couple of $100 right off the top. So great information, Lori. Here's another one for you. How long is the ultrasound schooling program at STCC?
So the actual program itself is 2 years. And you would travel, what I like to call is a cohort, or you travel with the same group of students. So you would start in the fall of 1 year, and that same group, they accept 10 students every year. So you would stay with that same group of 10 students for 4 semesters. But there is some work there's some admission prerequisites that you would need to do prior to the 2 years. So in addition to the 2 years, you may need another, I'd say at least a year to complete the admission prerequisites, and that would be based on how many courses you take a semester. It could take you a little longer to complete the admission prerequisites. But if you are, as I've mentioned in my presentation, if you are interested in that program, the best thing to do is to take a look at the website. It will list out what the admission prerequisites are, and that will give you an idea of what you would need to complete before you're even considered a qualified applicant. The admission prerequisites need to be completed prior to applying. But again, if you have any questions, feel free to reach out to me, and I will definitely review the program with you and what admission prerequisites that you would need.
Another question for you, Lori, is what is the yearly or hourly, which seems like the question, what they're asking is, what is the salary for a year or the hourly rate for ultrasound tech?
Let me see here. Okay, so the ultrasound tech, the 2019 median pay for an ultrasound tech was $74,320 or $35.73 an hour. And these statistics that I took were from these are from national statistics. That could vary a little bit in our area, but nationally, the median pay was $74,320.
Thank you. Dr. Andres, I have a question for you. And can a nurse practitioner deliver babies like a midwife?
So typically no. Being a midwife is a specialty in taking care of mothers through pregnancy and birth. But a nurse practitioner, if they work in a very remote area or rural area, may have some on-the-job training, because if they work like in an emergency room and a laboring mother comes in, they may have to deliver a baby. But overall, no. If you want to deliver babies, then the route for that would be midwifery or becoming a midwife.
And thank you for that information. And we do also have, there's midwifery information that I have at the Career Center, as that was still a career that's available. So if you're someone who's looking into that information, feel free to reach out to me directly, and I can get you the contact information for the agency that's doing that. Josh, I'd like to ask you, does Cooley Dickenson offer any volunteer opportunities, any summer internship programs? Or if I was a young adult and I wanted to do an informational conversation with yourself or any of the doctors, what does Cooley Dickenson offer?
Sure. Yeah, no, we do have volunteer opportunities. Again, things have changed certainly since COVID, and so there's not too many opportunities right now on site. But if you go to the Cooley Dickenson website, you can see that if you do a search for volunteer opportunities, you'll see information about there, including a volunteer application. It does require a bit of a time commitment, but like any good thing, you know, committing a certain amount of time, you'll get out of it as well. So there are volunteer opportunities. Internships, they're not a set program at this point for internships, but if anybody has any questions about just kind of ways to kind of learn and get involved, I'd be happy to kind of share or have you share my contact information for informational interviewing or otherwise.
Peter Gay, I don't see any other questions. Do you see any other questions in the chat section?
Phyllis, no, I'm looking at the chat and the question and answer section, and I don't see any additional questions, no.
Okay, so what we'd like to do at this time is thank our panelists. They've given us a wealth of information that all of us can follow up on. I think it's extremely important that we all take this time to really connect with these individuals. They've taken time out of their day to share what they do and how they're passionate about being in the healthcare field or helping those access the healthcare field pathway. And so I would encourage you, if you're someone who, even if you have a little glimmer of thinking, I might want to try this out, have an in-depth conversation. As Dr. Andrade showed you, that she started off initially wanting to be a lawyer. And then she got a little interested and she ended up getting a job at Bay State. And now she's a nurse practitioner. 10 years later, her life has come 180 in a different direction, and she is thoroughly enjoying it. And I think that just says a lot about the talents that we hold within Western Massachusetts and the talents all of you hold, that there are no limits, regardless of what you may be doing in school, what you may be thinking about. If you have an idea or you have a passion for something or you want to learn more about it, you have the opportunity to take advantage to go ahead and do so. So I'd like to thank Ms. Lori Malikan, Dr. Andrades, and Josh Maybar for joining us today and taking the time out for joining us today. We really appreciate the information you shared with us. I'd also like to take this time to thank my co-host. In our final session, you have made this a wonderful, wonderful sessions. And I just look forward to doing this again with you in the near future. And so thank you for hosting and always helping out in every way possible. I want to encourage everyone to go to our website where all 4 sessions are loaded to our page. We do have to record the 4th session, as we did have some technical difficulty, but that will be up on our page in the near future. But all 4 sessions at this time, if you're looking for more information from the different schools, the different representatives, if you want to get contact information for the different panelists, all of that information is available to you. And at this time, I'd like to officially say that the session is closed and that thank you for attending and have a lovely day.